Welcome to Heart Rhythm TV. I'm Deepthy Varghese. Guess what? HRX is just over a month away, and it's going to be an absolute game changer. Today, we have the incredible Dr. Aileen Ferrick, Assistant Director of Cardiac Electrophysiology Research and Nurse Practitioner at White Plains Hospital in New York. Aileen, welcome. We are excited to have you here.
Hi, Dee. Yes, I'm very excited to be here today, too, to talk about our session at HRX 2024. Since the remote monitoring guidelines were published last fall, there has been so much enthusiasm and discussion surrounding the recommendations. It'll be really exciting to share more ideas about that and some of the background of writing the guidelines, as well as what's come out since last fall when they were originally published.
Absolutely. Everyone is buzzing about the sessions this year, especially your session on future of remote device clinics. Can you give us a quick preview of what attendees can expect?
Sure. So the session title is called The New Horizon of Remote Monitoring. And so our objective is to talk about how we can best create an efficient remote monitoring clinic based on patient needs and clinic workflows, and incorporating the new and advanced technologies that are available to us. We're going to review some of the recommendations in the guidelines, and I'm very excited to have a very diverse group of panelists. So they include Amy Tucker, who runs a very large device clinic out of South Carolina, the Sanger Institute. Artie Delisle, who is a pediatric electrophysiologist at Vanderbilt. Camille Fraser-Mills, who is an heart failure specialist who's incorporated a lot of heart failure into the device clinic and the interface between those two. Dr. Janet Hahn from University of California, San Francisco. She works in the VA device clinic, and she was very instrumental in developing the section on the staff ratios, the recommendation for staffing for remote monitoring, as well as the calculator that we developed that can be utilized along with the document. And finally, Dr. Niraj Varma, who is from the Cleveland Clinic, and he has been very instrumental and has done a lot of research on alert-based follow-up. So 4 of our 5 panelists were part of the document writing committee. So in addition to talking a little bit about the more controversial alert-based follow-up, interfacing with heart failure, we'll delve into other topics, such as how are we going to incorporate wearable devices into the remote clinic? A lot of clinics are already having that challenge presented to them. Cardia, Apple Watch, Fitbit, those sort of things. We'll talk a little bit about AI and its expanding role with remote monitoring. Another big question that comes up in my clinic a lot is the patients are always asking, how come I can't see my data? So where's that going to lead in the future? Will patients have access to their data? Another major portion of our document was the disparity of the availability of remote monitoring across not only our country, but internationally. So we hope to have a little discussion on that. I'm really anxious to hear the questions that the audience will produce for our group during that session.
That sounds absolutely incredible. Now let's get into it. One burning question we've been hearing is about the challenges clinics face with remote monitoring. What are some of the biggest hurdles, and what are the best practices to overcome them?
Yeah, so prior to putting the writing group committee together for the 2023 remote monitoring document, we did do a survey of allied professionals that were members of HRS. And some of the hurdles that were presented with that survey was connectivity. That was a major focus of our document. How do you maintain patient connectivity, especially if in the future we're talking about alert-based follow-up, that you really need to have patients continuously connected. Other challenges, of course, were how do you get administration to understand staffing needs? How do you train and retain your staff for remote monitoring? It's a big investment. So some of the best practices we're going to talk about is part of our staffing plan or recommendation is that this is a team-based approach. It's not just clinicians, but it's also non-clinical members and what their roles and responsibilities can be in remote monitoring. We'll talk a little bit about third-party resources and where we're at with that and how that can improve efficiency and help with workflows. as well as, industry. That was another emphasis that we had in our document. What can industry do to help us with remote monitoring, connecting our patients, and having an efficient workflow?
Okay, here's a hot topic, AI in healthcare. Incorporating AI can be daunting for many clinicians. How is AI being woven into remote monitoring, and what advice do you have for those who might feel a bit hesitant?
Yeah, so AI is a hot buzz topic now, isn't it? And we'll see how that directs us with remote monitoring. As I currently see it, there was such a huge influx of data that remote monitoring clinics had to deal with after implantable loop recorders or implantable cardiac monitors, however you want to call them, were implemented into the remote monitoring clinic. So now AI has helped improve the efficiency of eliminating false positive alerts, which can really overtax our staff. So that's one way. Another way may be algorithms that can be developed to pick up ventricular arrhythmias to prevent patients, intervening with patients before getting tachytherapy. We'll see. This is a new topic. I'm really anxious to attend HRX so I can learn more about how AI is going to work, not just for remote monitoring, but for EP in general.
This session is a must attend. If you're not excited, you will be. HRX is the ultimate event for anyone passionate about the future of cardiovascular innovation. Plus, being from Atlanta, I can tell you there's no better place to be for cutting edge healthcare discussions. Aileen, thank you for joining us today. We can't wait to see you at HRX.
Thanks, Dee. Really looking forward to the sessions in general and our session in particular.